primarily again on the Ditech Solutions. So the companies, it's a healthcare tech company, primarily focusing towards revolutionizing the healthcare diagnostics, primarily to improve patient care. And the most important aspect is now they are focused toward AI. So primarily from the leadership perspective, the focus is toward AI. Another important aspect what we need to see here is it's a tech company. It's not non-for-profit or NGO any. They are for profit. So I think that is very important. The company's revenues are around $30 million. Budget that's defined for AI. That's clearly defined $4 million from the leadership. See, the leadership itself, forward thinking, and the CEO primarily again, in fact, defined the AI vision, and he asked all the in fact stakeholders to start working on focusing on what all things could be worked in AI. So AI leadership again, they have hired a technical talent here. So a chief data scientist is hired, and a team is there who is expert in data analytics and designing the AI solutions. The tech readiness for AI, the infrastructure maturity, the partnership what they are having with NVIDIA and other partners, that is something which is very high. And the governance framework, processes, data, all those things, they are already having it set. So the company is primarily ready for tech and AI solutions. Yeah, can we move on? Next slide, please. So the four initiatives, I think one is diabetes onset prediction. I will not be going in detail, but one important thing here is they are already having data around 98,000 patients. They have data. Number two, they are having integrations and partnerships primarily to capture the vitals, HbA1c, all the details through devices, apps. So all those parameters are being captured. Of course, the thought leadership is there. They would like to present it in HIMSS. So basically, the CMO wants the CEO to present about the thought leadership in HIMSS, which is one of the healthcare event, and that's where we see the thought leadership aspect, what they want to prove in the industry. Data access, definitely a reliable data, what is there. So for any AI solution to be successful, the data should be reliable. So that is a very important aspect what has been mentioned out here. And of course, the support from the leadership is there, and the entire team is available. And the major aspect what we see, yes, with this one of the feasible solution, it aligns to the organization vision and mission. Let's move on to the next. Yeah, I think this we can move. Other aspect is epidemic AI predictor. So this project sponsor here is a public health strategist. So that is one area what we see here. Even if it is a public private partnership, that kind of a model is coming. So the important aspect is when we are developing AI solution, and IP is something which creates the value for the organization. So here I think there are a number of questions which are coming. 100K budget is allocated, but again, there are 10 MVP. So 10 companies, they are trying for it. So that budget is being allocated for the partnership, and after 12 months or that period, that budget would be given, $5 million budget would be given. And again, that is not sure, right? So it's not something which is reliable. Data being collected from different sources, again, those are not reliable. That is one of the challenge. So the feasibility point of view, if I see whether the solution would work or not work, there is a question mark here. Let's move on to the next. Third is a CRM optimization. So one of the aspect primarily, this is by Chief Revenue Officer. So today what we are seeing in the industry, if we were to see this solution and the diabetes one, there is a connect. How it is connected? If we see diabetes is a lifestyle disease, and CRM is something through which we can connect different patients, different kind of indicators, different kind of information. So this is an engagement tool, and diabetes is being a lifestyle disease. This is something which becomes important, but again, if we need to choose one of them, because when you go for diabetes, of course, the FDA and all the compliances would be coming. So the budget we have is $4 million. So that's one of the aspect I see, but this is something which would also be an important, but through partnerships and other things can be achieved. So again, if we see the alignment from the organization vision and mission, it's not aligned directly to the vision and mission, but it helps to achieve the objective as a add-on solution. So I think this is what the third solution what was there. Now this is basically through generative AI, we can generate the content for marketing, all the videos and all those aspects, not directly aligned to the organization vision. So this is another fourth solution what was being mentioned out. So now we'll be moving on to what we have opted for. So we opted for diabetes onset prediction. If I am having a budget here, we would have gone with CRM as a second one. But right now we'll be going, if we need to go, we can partner with another company. Diabetes onset prediction with CRM integration could be one of the solution which can primarily make the objective of diabetes reversals and all those programs successful. Let's move on to the next. So, if we see primarily strategic alignment is very high. If we see all the 4 solutions which are there in diabetes, yes, this is something which is aligned to the vision and mission of the company. Number 2, significant market opportunity. There are proven research reports and there is a market, total addressable markets if we research, that is available. So, and this is a need of ours, it's across the globe. So, primarily we can create an IP, we can define a solution, and this is something where a very high revenue potential is there. Third thing, what thought leadership could be demonstrated in the industry. So, that is another aspect which again aligns to the vision and mission of the company. There is a clear defined budget what is given. So, in $4 million, if we see, yes, definitely the solution could be defined because data access is there, infrastructure is available. The important aspect what is coming here is, once the solution is successful, definitely the additional budgets may be required for FDA and other compliances, but though it was not part of the case study. But yes, I think this is something which is feasible in that particular time frame, it is possible. And the team is already there, tech strength is there. So, if we see the alignment with the firm strength, AI leadership, strong team is already there, a team, data accessibility with ground truth data is available, a high revenue opportunity is there and high clinical impact is there. So, these are the primary reasons. If I see diabetes one, it scores very high. Vis-a-vis, if I see the other solutions, CRM would be the second one. Epidemic, again, it doesn't align to the organization vision because I am not sure whether the IP is something which is going to be with me. It's a public-private partnership. So, if it is a for-profit organization, there is a different way to look at it. And the last one is the Gen AI, what we were seeing. So, that is something which is very less aligned, primarily what we analyzed for. Yeah, so any questions?